evening and welcome to our new show, VOXIPOP Community Town Hall. I'm your host, Brooke GINTY, and tonight in our first edition of Community Town Hall, we are streaming live on Facebook.com and VOXIPOP.com. Tonight's show is dedicated to the local efforts in the battle against COVID-19. We have a terrific lineup of local doctors and government officials who will be joining from their homes safely to discuss the efforts from a health and community perspective. As a reminder, we are live, so be forgiving, and also please submit your questions and we will try to get to as many as we possibly can. Tonight's program will also be recorded for you to watch in the future. So let's begin. I'd like to introduce our guest panelists. Joining me tonight is Dr. Brian Broeker from Phoenixville Hospital. Dr. Broeker is a head and neck surgeon with ENT and allergy specialists and the lead member of the COVID-19 Surgical Safety Committee at Mainline Health. Good evening, Dr. Broeker. Welcome.
Hi, Brooke. Thanks for having me. I am happy to be here tonight and looking forward to talking to our community about the COVID issue that we're facing today. Another one of my jobs is I'm the chief medical officer for a group called the Physicians Integrated Network, which is a large group of 650 physicians in the city. And we have a lot of experience in planning value-based medicine for large populations of people. So that relates to where we're trying to make changes for the COVID-19 problem and trying to deal with it on a large basis.
Perfect. You're going to have some valuable insight tonight. Thank you for being here. Next, I'm going to introduce to you Dr. Carol Achter. Dr. Achter works in the Allergy and Immunology Department at Phoenixville Hospital and is trained under Dr. Anthony Fauci during the initial AIDS epidemic in the 1980s. Hello, Dr. Achter. Welcome to Community Town Hall. Sorry, Dr. Achter, I think you're still muted. Everybody's done it during a Zoom call. It's totally okay. Are you there? I still can't hear you.
It's a pleasure to be included on the panel, Brooke.
There she is.
I practice both. Thank you. I practice adult and pediatric allergy and immunology in the Phoenixville and in the Pottstown areas. And I've been involved with treating infectious diseases for the past 30-odd years. I had the opportunity to work with Dr. Fauci during the early years of the AIDS crisis before we had much knowledge of the disease. It was this experience that left me with a keen sense that all knowledge about disease comes from scientific study, not speculation and anecdote. Chester County in general and Phoenixville in particular hold a special place in my heart. I grew up in Schuylkill Township, I live in Charlestown, and I'm very active in the Phoenixville community. And I use community in the truest sense of the word. We have a wealth of resources here that can help us get through a crisis like the one we find ourselves in now.
Thank you very much for the introduction and the background in your experience. Welcome. Next, I'm sure you're also very familiar with Dr. AMIT GANGOLI, the head of the Infectious Disease Department at Phoenixville Hospital. Dr. GANGOLI has extensive experience in emerging pathogens such as new viruses. He has worked on hospital infection control committees and helped plan emergency preparedness for emerging infections. Dr. GANGOLI, thank you for joining us this evening.
Hi, Brooke. Thank you so much for inviting me to be part of this panel discussion. I've worked closely with Brian and Carol, and I've now lived in the Phoenixville community for the last 10 years. I practice mainly infectious diseases at Phoenixville and Pottstown, but also, go to Chester County and Einstein, Montgomery. So I cover a fair, amount of ground here. I've had, and lived through 9/11, the post 9/11 bioterrorism scares, when hospital epidemiology and actually disease monitoring became a keystone of our emergency preparedness at the University of Pittsburgh, which then became actually part of the Department of Homeland Security model for pandemics, as a matter of fact. And so, I feel I've lived through many of these pandemics, but this one poses its own unique and special problems and challenges. I've also been in a consultative role and advisory capacity for infection control at most of our hospitals, as well as actually at many of the nursing homes. So what I bring to this table is, of course, also a lot of the, tip of the spear in a way, because I've been actually one of the inpatient doctors, treating most of our COVID-19 patients in the hospital side. So I look forward to this discussion. And, finally, we also love being and living in Chester County. My wife is actually a volunteer with the Kiwanis, so at Phoenixville. So, I think we really, appreciate and all this community has to offer. So thank you for inviting me.
Thank you so much for being here. I do think, as the doctors have mentioned, they are on the front lines here in Phoenixville and on the main line, and we see a lot of national news and a lot of national doctors, and I think it's so important that you are bringing the information to the community locally, so thank you. In addition, I would like to introduce our next guest, nurse practitioner and director of adult gerontology primary care nurse, Kate Demutis. She is a primary care nurse practitioner program at the University of Pennsylvania. Kate, I botched it, so if you want to come on and give the real introduction, I'd appreciate it.
Thank you, Brooke, and thanks for including me in your panel. As Brooke mentioned, I've practiced in primary care in the Phoenixville and mainline area for over 20 years. So as a primary care provider, we're often the first stop for patients that exhibit symptoms that could be related to COVID-19, in addition to many other types of symptoms. And I also work as a faculty member at the University of Pennsylvania School of Nursing, where we train graduate level nurses to become nurse practitioners. Thanks for having me.
Thank you, Kate. That was much better than my introduction, so thank you. Next, I'm very pleased to introduce to you Commissioner MARIAN MOSKOWITZ. She is the chair of the Chester County Board of Commissioners. MARIAN is also the Chester County Economic Development Council chair and the Southern Eastern Economic Development Council of PA. She's a member there. I call her our president of Chester County. Welcome, MARIAN. Come on and join us.
Thanks, Brooke. Thanks for having me. It's really nice to be with everybody in Phoenixville. So I am, as you said, chair of the Chester County Board of Commissioners, but I've also done a lot of work in the community, both in the nonprofit sector and the for-profit sector. I've owned many businesses, small businesses locally in Chester County, and developed some real estate in Phoenixville, and have been part of the revitalization of Phoenixville. So I'm very happy to be here, and I'm looking forward to this discussion.
Thank you. We are also pleased to introduce Phoenixville Borough Manager Gene KRACK. He will be joining us tonight. Gene has served as Borough Manager since 2008 and has overseen the dramatic growth in this borough for the past 12 years. Hello, Gene. Thank you for joining us.
Hi, Brooke. Thanks for having me tonight. I'm very pleased to be here. I'm excited about what's going on with the team that I have. As you know, some of you know, I spent 20 years in the Navy, and in that time frame, the Navy and the military is all about exercises and dealing with all kinds of events throughout the world. And I don't know that they prepared us for this, but the experience that I learned through those 20 years is helping me lead this team of people that I have in the borough to get us through all of these events that we possibly can. Thank you.
Thank you so much for being here. Your experience is invaluable. Our last and final guest likely needs no introduction. He is the Mayor Peter, the Mayor of Phoenixville. After spending the better part of the last 12 years in corporate communications and then running his own digital marketing company, Peter has brought his enthusiasm and energy to the entire community of Phoenixville and beyond. Hello, Peter. Welcome.
Hi, Brooke. Thank you so much. And thank you to all the other panelists for being here tonight. It is such an honor to be here with you. And most especially, it is an honor to be here and to represent all of the incredible people in the Phoenixville community. I just want to thank all of our physicians, all of our medical practitioners, to our nurse practitioner, Kate. Thank you so much for being here. Thank you for being on the very front lines of this fight. And also to our elected officials and also to Gene, our borough manager. Thank you so much, MARIAN, for your leadership at the county level. And Gene, I can't even begin to tell you how much we appreciate you here in Phoenixville and all that you do for us on a daily basis. So thank you. Thank you for everything that you do, and especially during this very difficult time.
So before we begin our discussion, I'd like to remind our viewers that I'll be fielding your questions for the guest panel. Please use the chat function on Facebook and VOXIPOP to send us your questions, and we will try to get to many as we can. We know that this has been a challenging time for all communities in Chester County with the coronavirus shutdown. Hopefully, we can shed some light on what our area doctors and government officials are doing to fight this pandemic and put our community back on its feet. I'm going to start with Dr. Broeker. Dr. Broeker, how much and what kind of testing is needed to allow the reopening of businesses without increasing the risk of a second wave of COVID-19?
Well, Brooke, to answer that question, I wonder if it's okay. I have just three slides I'd like to show everybody. I think it's going to help explain a little bit and answer that question, because I think it's very important.
Absolutely. Feel free to share your screen.
So let me go through that. We have to be able to get to there it is. Okay, so, sorry, first slide here. This is the curve that most of us are used to seeing when we see that on television, and they talk about flattening the curve. And I really wanted to be able to show everybody today what this means and what happens after it, because first on the curve, we get the impression that this is the end of the problem. But we're going to talk about first what they were trying to do and why this isn't the end of the issue, why we have to go beyond this curve. So first, we all are familiar with this curve, and it shows that without protective measures, this line here represents the capacity of what the hospitals might be able to take care of when people come in sick to the hospital. And without the protective measures, you have too many people coming in. So the only protective measure we're really using right now is social distancing, is we're staying home. And so when you have the social distancing, we can flatten the curve and we can come here. But this doesn't get you to the end of the story. So far, this gives us fewer infections and deaths. It protects the healthcare system and the ability to treat the virus. It also buys us some time to get equipment together, to get supplies together, and to get procedures in place so that we can move to the next phase. Now, the problem is what happens to the right of this. So after this, and once we start to get to the down curve, the next curve looks like this. So here's the first curve. But once this comes down and we go here, we're going to start talking about wanting to get out and get back to work. And I think that's what a lot of our audience wants to see today, is how do we get back to work? But once we get back to work, there's no way around it. The cases are going to start going back up again unless we have other measures to replace the social distancing. And that's where the testing you're talking about comes into play. So there's several things that come into play here. And if we allow it to go back up again, we're going to have the same situation we have today. Once we get here, we're going to have to go out of work again. Nobody wants to see that. Instead, where we want to go is something like this. And this is from a great article I encourage everybody to look at. It's on a website called medium.com by a gentleman named Thomas Puyo. And he talks about the hammer and the dance, but he's talking about the hammer to bring down the uncontrolled cases to a controlled cases where you're cutting the growth, you're recruiting personnel and getting your systems together, including the testing. And then what he calls the dance. The dance is, so instead of having this curve be a large curve, it's a very low curve. But the only way it's a low curve is if we have the proper testing, contact tracing in place, along with continued public education, hygiene, and avoiding large social gatherings. But mainly, we'll be able to isolate small pockets of sick people instead of isolating everybody, only if we have that proper testing in place. So what is that proper testing that we need to have done? Well, we need to be able to have rapid testing. That means that we can get testing done within 24 hours or less. We just don't have that today. We have very limited capacity in that. And I'm talking about single digits at any of the large hospitals on a daily basis. We need to be able to have thousands and thousands, maybe hundreds of thousands of that done if we're going to be able to do the testing. We then also need to be able to have contact tracing where we can find out who's infected, find everybody that they might have been engaged with over the past several days and may have gotten them infected so that we can isolate them too. And there's several ways to do that. And we have to be able to isolate those small groups of people. But that's the important part that I want to be able to make to patients or our public is that people are anxious to get out. People want to get back to work. People want to get back to socializing, but ending social distancing can't happen by itself. It has to happen by replacing social distancing with the testing and the contact tracing. So that, I think, is the answers there, bro.
Okay, thank you so much for that.
Yeah.
All right. I know, you mentioned about the curve, and I think one of the things that's important is we have to learn from the other communities around us. And I know our physicians have an incredible amount of experience beyond Phoenixville. So let me ask this next question to Dr. GANGOLI. How can previous experience in other areas of the US and the world inform us about how we can safely reopen our local and regional economy?
Brooke, one of the things that so
we can hear you, Dr. GANGOLI. You can go ahead. Actually, I'm sorry, we can't hear you anymore.
All right, I think it should be good now.
You're good. You're good. You're live.
So the experiences, I think, when you asked about, where else in the world we've seen people do it differently. I mean, the one country that comes to mind is, I guess, Sweden, right? Because Sweden is the one country that basically did not really have a true lockdown and said they kind of wanted to, isolate or quarantine their high-risk populations, mainly their nursing home populations. But for the most part, people went about with some degree of social distancing. And actually, it seemed like they were kind of in this model of trying to build up herd immunity. But actually, data that they've now started to see a fairly significant number of cases, particularly even deaths, more than 2,200 as compared with, maybe 5 times less in neighboring countries like Norway and Denmark, which have, quarantined. The other experiences I think, to take, note from would be, maybe a model like in South Korea, where they actually tested extremely rapidly and widely. And that, I feel, is one of the keys where we, I think, in the United States, were a little, slow in getting off the ball. So we, as of today in the US, have probably tested, barely 1%, of our populations. And widespread seroprevalence testing in, California, for example, and more recently even in New York City, suggests that, the level of infection in some parts of New York City was close to 20% of people. So until we develop, widespread rapid testing, as Brian said earlier, I think it's going to be challenging for us to sort of decide when and how to open up, because the basic challenge is going to be trying to, open up in a painless and coordinated manner so that we don't have to go through repeated episodes of lockdowns. So right now, I think everybody in the world, various countries in Western Europe are trying to sort of figure, and they're ahead of the curve and have flattened the curve, compared to where we are. So it might be actually interesting to see how Italy and, the United Kingdom, for example, open up slowly or in, different fashions. So thank you.
Thank you so much. That is invaluable experience to bring to the table. Let me switch over to Kate Demutis. I think a lot of people probably have heard this, but I want them to hear it from a nurse practitioner who deals with it on the daily. Tell me a little bit about what these symptoms or signs are for coronavirus and how our community can approach, when they should call a doctor and what sort of symptoms they might be feeling.
Sure. We know that this virus can present in a number of different ways. The typical symptoms that patients may encounter would be fever, cough, and often respiratory distress. We also know that patients will get potentially body aches, headache, sore throat. So many of the typical symptoms that we encounter this time of year with other respiratory infections or even allergies. And additionally, now we've seen several cases where there is a new loss of sense of smell or taste. So I think, Brooke, it's important for people to know that if they develop some of these symptoms, they should contact their healthcare provider. Many patients will get better at home. Many mild cases can recover at home with rest and hydration and just allowing the body to heal. But other cases, will have more severe symptoms that present, primarily a more progressive difficulty breathing, and those patients definitely need to seek medical attention.
Thank you so much for that guidance. Dr. GANGOLI, would you like to add something into that?
Yeah, hi, thanks, Brooke. One of the things that I wanted to actually add to what Kate said was, particularly about the shortness of breath. One of the things that we see with, especially on the inpatient side of things, is this, concept of air hunger. And I tell my patients, when you're in the outpatient setting, one of the things that you might experience is fevers, actually, which can be hectic. When I say hectic, I mean up to 103, 104, lasting for several days. And, if you're not short of breath, that can, you can still probably write it out at home. But if you immediately start to feel short of breath, that's when I want you to come into the ER right away. The other concern that we've seen actually with these patients, surprisingly, in the hospital side of things, is that even though they're, they may seem like they're doing well and not, very, in distress, when we actually look at their saturations, they're very low. And in fact, one of these terms we're seeing in the hospitals, we call them the happy hypoxic, because they are hypoxic. They are starved of oxygen because of decreased oxygen delivery in the lungs. But they're scrolling away on their cell phones, on their iPhones, and they are talking and chatting with their nurses and doctors, and it's quite concerning. And that's, been the, experience in the hospitals. The only other thing I would add is that a good 30% of patients actually seem to have fairly significant GI symptoms. We've had a lot of patients have, significant amounts of diarrhea, to the point that we've actually got stool cultures thinking that they might have an infectious diarrhea, which it in a way is, but it's a viral infection from COVID-19. So that's just what I wanted to add, what Kate said.
Thank you. One of the things I think that we've realized as this has gone on is it's ever changing. And we, the community of doctors and our government, we're all learning something on a new day. And I think that's why it's so important to have these ongoing conversations. And I think we all recognize the struggle that we're feeling from an economy and how we balance that with the actual disease itself. So let me ask a question to Dr. Akhter. How do we balance the economic cost of continuing restrictions versus the public health cost of potentially having a resurgence of infections?
Well, Brooke, that's a very complicated question, and I think there's no easy answer to that. Putting a price on death and increasing the rate of mortality is very difficult. There's no question that relaxing social distancing will lead to a higher mortality rate. Obviously, there is a cost to delaying reopening of our business economy, our schools, and our social activities. I was just talking to Dr. Broker today about patients who have delayed, quote, elective surgery and had adverse consequences because of that. And there's a fine line between what's considered elective and if it's put off, is no longer elective. May become non-elective, and so those are consequences of us putting those things off. And so there are both medical, financial, and societal adverse outcomes to staying in place, sheltering in place. And it's very, very hard to balance those costs. Again, it comes back to quantifying testing and tracing again. And I think we need to do a lot more testing. Once we have the ability to do that testing, the key is having the personnel or the technology in place to trace those positives. So it's not enough to test if we don't follow up those with the isolation of the positives and the tracing of their contacts so that there's not spread to the wider population.
I would like to, Dr. Broker, I think you have a follow-up for Dr. Akhter.
Yeah.
Go ahead.
Sure. I wanted to add something into what Dr. Akhter had to say. When you're talking about and trying to decide how do we get back to an economy and end the social distancing, it's not an either or choice. We can get back to the economy, if we replace the social distancing. So we're trying to replacing that with the contact tracing. But the key is to be able to do it effectively. And one of the problems that the epidemiologists are telling us is that the disease that we're talking about, COVID-19, can spread through patients who are asymptomatic. And that presents a big problem because you don't really know then who to test. And so the contact tracing has to be very fast and very effective to be able to catch up with that. And so if you look today, just today, New York State announced that they're doing a partnership with the Hopkins School of Public Health, and they got former Mayor Mike Bloomberg to get involved. And they're looking at more technology, because when you rely on people, if you think about how contact tracing works, say somebody goes to the market and they find out the next day they're sick, the contact tracing people have to go back to that market, find out everybody who might have been close to that person, and then find out who everybody they were close to. And that's just one event. It takes a gigantic amount of man hours and time. So what everybody's trying to replace that with is what they've already shown is working in Europe and Asian countries where they're using technology. And this becomes a bit of a question because people worry about their phones tracing them and where they go. But from a public health point of view, it's much more effective and efficient because the cell phones can tell instantaneously everybody that you were around simply by having Bluetooth connections where everybody goes all day. And this way, if somebody was infected the following day, it can look back at the past week and say, okay, everybody we were near gets a text, an anonymous text that says you were near somebody that was infected, and now you have to get tested or isolated, however we decide to do that. And that's what they're looking at in some other states. It's what they're doing successfully in some other countries. It's something that I believe we have to look very seriously at here, always with an eye on what people are concerned about, the privacy concerns. But that is going to be the most effective way, and probably the only way, to get us back to business without causing a resurgence so that we can do both at the same time.
That makes sense. And I think it's very important to note we are in a whole new different world and a challenging world. It sounds like we have testing, we have tracing, we have diagnosing. There's a lot of different layers to this story. Dr. Gangoli, did you have something that you wanted to add?
Yes, hi, Brooke. Thank you. What I wanted to say was this. Historically, every pandemic, has only one way that it ends, which is when you develop herd immunity, right? I mean, we all understand that. But that means we reach this magic number of 60 to 70% of the population needs to develop that degree of immunity, so that when you develop that degree of immunity, we can then allow a high risk or elderly populations to then come out so that they won't get exposed to younger or asymptomatic people, as Brian said. The challenge here always is one between lack of testing. And that's when the testing, has come to essentially the inadequacy or the, inability to widely test the population. And once we have that, and we're expanding that very rapidly, so now that comes into two categories, right? Because we talked a little bit about testing earlier. So we have PCR tests, which is trying to check for people who are actually, who have the virus. And then we have the challenge of antibody tests. And there's, 20 different antibody tests there, whether they're rapid or otherwise. But we're trying to say, what if you have a swab for COVID-19 and it's negative? If it's a false negative, then if I have the ability to get a rapid antibody test, then I can pick up some of those false negative swabs. The other concern is, if I have a positive antibody test, how reliable is that test, right? So the accuracy or the specificity, as we call it, is very, very important. And the way that is important is because if a test is 95% specific or accurate, it still doesn't mean much if the total prevalence of the disease within the community is less than 5%. That's what we call the Bayesian probability that the test is actually correct. And that's why until we have a better idea of what the prevalence in the community is, we won't be able to get a good, feel on how safe it is to open up. And that's the, magic balance, as you will. And the last point I wanted to make, which is, I've talked to so many of my physician colleagues, I always say now, I call it WhatsApp Academy because, everybody's on WhatsApp, I've heard like so many different opinions. I say I've already got herd immunity because I've listened to so many opinions. But the final thing I wanted to say was, I said, I do feel very, disappointed that, in our country, as politicized as we are, and I see this almost, as a comment, that the response to this has sort of become a blue state versus, a red state, if you will. I mean, I think it's a shame and it's a false, position for somebody to believe that public health awareness becomes more of a progressive or liberal, approach versus economic patriotism, becoming more a conservative thing. And I think that's wrong. And so if we sort of go at it, in that antagonistic way, I think it's, unhelpful. Thank you.
So I think that actually is a, great transition that we can bring in from our physicians into our local government, because we have all of the scientific data in the background, and then we have to move and we have to implement that on our streets. So let me start by sending a question over to Marian, who, as I mentioned, is the chair commissioner of the Chester County Board of Commissioners. Marian, can you just describe a little bit that, some of the partners that you work with on a county level in making decisions about Chester County and how we respond to COVID-19?
Sure, Brooke, I'll be happy to. I mean, we've worked with so many, but I'll just start with my fellow commissioners, because we were thrown together the first week of January, never having worked together, and they are my most valuable partners right now, as long as is our county administrator. But, we're working with our state senators, our congresswomen, our county legislatures. We partner with businesses, as the one in Chester County that helped us acquire 3.5 million pieces of PPPs for our emergency responders, our hospitals, and helping our neighbors, Delaware County and Berks County. We sourced for all of them. We've partnered with a Chester County business to acquire rapid antibody test kits. And just last week, we received 825 gallons of hand sanitizer from 8 Oaks Farm Distillery, and they partnered with Wawa, who provided the containers. So we were able to distribute those to our healthcare workers and our prison and our long-term care facilities. Lastly, we've been working with the counties of Bucks, Montgomery, Delaware, and the city of Philadelphia as a region. We actually talk every day at noon to find out what other counties are doing, how we can coordinate, how we can help each other, and discuss trends in our COVID-19 numbers. I think partnerships are just critical in these types of situations, and we're lucky to have a lot of great partners in Chester County.
You mentioned antibody testing, and I know you just said it, but I believe we're one of the first counties to implement that testing. Can you tell us more about it and when you think it might be available to our residents?
Sure. So when COVID started coming across the ocean, our health department started to look at it. They were looking at what South Korea was doing and the way everybody was starting to deal with testing over in Asia. We knew that testing is just an important part, and not just the swab testing, but you could see the need for antibody or serology testing. So we were looking around at different companies, focused more in Chester County because we have a bio life science division here that's pretty strong. And I was talking to Senator Dinniman one evening, and he said to me, I just talked to a company who does that. So he introduced me, and it's one of Chester County's great stories, because I immediately called the company, the gentleman, and we ended up ordering some of the kits. The kits are 94.4% accurate, and they test for IgGs and IgMs. But we want to use those as a means of getting information. And so we are using them now in our Pocopson home, the senior long-term care facility that the county owns, in our prisons, our youth detention centers. And we're looking to partner with a lab to begin testing our first responders and all county healthcare workers, including just doctors that practice on their own and nurses. We're at the forefront when it comes to antibody testing, and it's great. It's even better because we're using a Chester County business. We know that having the information from the antibody testing will provide a way forward to start operating businesses and making good decisions with some data, instead of just because we have to make that decision.
I think that's very important. Like I said, we are going to be mirroring all of the research and health perspective with the feet on the ground. And that means our governments, that means our county government through you. And let me take the opportunity to switch over to Jean KRACK, because Jean is running the borough of Phoenixville. Jean, let me ask you, I have a question from Julie in Phoenixville. How can you get access to borough services, and what is the plan for reopening Borough Hall, which is currently closed, for those who don't know that?
Let me first state that while the building itself has been closed, our operations have been ongoing. As the doctors would testify, we're a developed nation because we do things with water, with sewer, with trash, and what have you. And those guys and women have been working hard over the last almost 2 months now, continuing to process good water, take wastewater out of the system. The things that go into the trash and recycling, those guys are facing every single day what people dispose of, not knowing where it comes from and what have you. So they're all doing those things. Our police departments, our emergency services, all functioning. We have been functioning internally through remote access to keep the function of the borough as governance ongoing. The doors themselves have been closed, but that doesn't prevent the folks from going to our website, looking at social media, and getting access to the myriad of things that we have available to them through our website. And then our website goes off to MARIAN and the county, to the state and other locations. So you might not think about something like the spotted lanternfly right now because of this pandemic that we've got, but we've got information on that because the bugs don't stop doing what they do. Tonight we've got teams of people out on the street because I've got 5 streets closed down because of trees that have been felled by the wind and the rain and what have you. So the borough hasn't stopped working. I hope I conveyed that in a good way. The doors are closed, but the borough hasn't stopped working. To answer the question about when do the doors open, right now, I've targeted the 8th of January, 8th of June as the date to come back. And the reason for that is because before the 13th of May, we had already started breaking our various groups of people into teams, into thirds, so that 2 weeks apart, we could bring these people back. And we'll start doing that one group at a time, May 11th, May 26th, and then full operations on June 8th. And that's, of course, depending on what happens in Southeast Pennsylvania versus the governor's phase plans. We know we're probably going to be last in that. So I hope I've answered that question for you.
You did. And I want to actually take the moment to say thank you to all of those essential workers who are continuing to work. When I hear the trash bin come Wednesday mornings at 8, my first thought is the trash out? But then my second thought is thank you to those incredible people who are continuing to do everything on the daily basis that keeps our lives safe in our home going forward. So just a heartfelt thank you from us here at VOXIPOP, as well as I'm sure the panelists can support and agree with that statement. Let me just ask you, Jean, what role can our community and members within our community do to help now and to help stop the spread?
I think the doctors have said it, and I think the science is saying it, and that is social distancing, stay safe, get out. Our trails are open and our parks open. Our equipment is not. Utilize those services on good days and get good oxygen, stay healthy, and quite frankly, don't do the things that people seem to want to do. And there's no reason to go fill your freezer full of stuff when you only need this amount of groceries for this week or what have you. Those are the things that we as people need to do on a constant basis. It's just be calm about it and do what we would normally do, but practice what the doctors and the scientists are telling us to do.
I think let's bring in Mayor Peter here, since for any of you who follow him on Facebook, long before the crisis hit our community, he was everywhere. And it seems like he is more everywhere because I know he's helping all of our residents. So you're kind of our man on the ground, Peter. Can you just let us know how you think Phoenixville is handling this crisis?
Absolutely. Thanks so much, Brooke. And I just wanted to point something out. We never reiterate this enough, but I'm very fortunate because I spend a lot of time working with our police department. And I always say they're 24 hours a day, 7 days a week, 365 days a year. And that is true. But I will tell you that they're 24 hours a day. Brian Watson, the head of our public works, and those people who are on call 24 hours a day for the borough to help with everything from water, sewer, and of course tonight, as we have the storms raging, they are still here and they're still serving our community. So thank you to those incredible people who often are forgotten when we're giving out those wonderful accolades. But I would say, Brooke, we've been very fortunate. And I think having this town hall is just reflective of what an extraordinary community Phoenixville has. It's funny, I'm like sitting here and first I'm like, wow, we're like the Brady Bunch. We're all, like you said, Brooke, we're in our little boxes. But at the same time, I'm just looking at all of the people on this panel and it's absolutely incredible. The talent, the raw talent in this community and in our county, and the people who are focused, Kate, the doctors who are focused on a daily basis taking care of our health, Marian and Jean who are taking care of everything from keeping the lights and the water running to ensuring that we have the supplies that we need. Our community was very fortunate because Phoenixville began probably, I would say, we've always had plans in place for a pandemic. And I will say mayors have very interesting roles. One of the things that we do, of course, is working predominantly with emergencies. And we sign emergencies, 2 or 3 times a year. Specifically, Jean and I have a great time with snow emergencies and parking and trying to the streets. But we certainly always have those pandemic plans in place. We review them, but it's never something you think you're going to take off of the shelf. And I think probably mid-January, Jean and our Office of Emergency Management and I started to have conversations that we probably needed to take those plans off the shelf and just make sure everything's in place just in case. And then, of course, everything continued to progress. And on March 10th, we were one of the first communities in our area to really open up our Office of Emergency Management, which is Karen Williams, our director, and our EOC, which is actually where I'm stationed right now, our Emergency Operations Center. I will tell you that Phoenixville is a community unlike any other. In basically a very short period in time, we were able to mobilize a number of business leaders, nonprofit leaders, medical leaders. We got meetings in place that now continue once or twice a week with hospital personnel, our healthcare providers, our nonprofit community to ensure that we have people that people have food that they need, they have their housing is secure, that everything that they need in our community to feel safe is here and provided to them. And so we are very fortunate as a community to have all of those pieces in place. I will tell you, Brooke, we give out about 12,500 meals a week here in Phoenixville, and that is all due to the extraordinary people in our school district, our senior center, and the incredible nonprofits that we have, and also the great work of people like Marian who help us to get the resources that we need in Phoenixville.
I've been in the borough since 2009, and I often speak with other residents, and I don't know if it's something in the water or what it is, but we really, when we say in this together, in Phoenixville, we mean it. Our nonprofits are all working together. Our school board is working together with the locally. And it's a privilege to belong to this community because we truly care about our neighbors. So, and we are so thankful, Peter, to have you at the helm of this, our borough in general, but you provide a lot of light and love in this process. So thank you for all the things that you're doing. Let me step and give a question to Kate Demutis. Kate, we've talked a lot about science and data and all that kind of stuff, but I want us to address what can we do to protect ourselves from coronavirus? And the other doctors can feel free to add in, but Kate, can you start? What can we do to protect ourselves here?
A lot of it comes down to the basics. We keep hearing it, but we need to wash our hands and do that often. Use soap and hot water and wash for 20 seconds at the minimum. You need to keep a distance from other people. 6 feet is what's recommended, and wear a cloth mask when you're out in public around others. Know that wearing a mask does not substitute for social distancing. We all really need to do all of these things together to protect ourselves from catching germs from others. And the other part of it is just Cleaning surfaces regularly, daily, cleaning doorknobs, light switches, countertops, cell phones, computer, tablet tops, any of those items that we're handling daily should really be cleaned and disinfected regularly. And the only other thing I would say in addition to that is get a good night's sleep, eat a healthy diet, and exercise. Get outside and get the fresh air. Take care of yourself at this very stressful time.
Thank you for those key tips. I know that I personally probably don't wipe down my own home because I think we feel our home is a safe space. And I don't personally wipe down my countertop every day with a Clorox wipe. First of all, we can hardly find them. Second of all, but I think that that's a really important factor. And I will ask this question because it's on my head. If I'm wearing a mask, do I still have to keep my 6 feet distance? Doctors, Dr. Broker, can you answer my question for me?
Sure, I can answer that for you, bro. Yeah, when you wear the mask that most people are wearing in public is different than the one in the hospital that protects the healthcare workers. And you can make a mask out of just simple cloth at home. The goal of the mask is to keep water droplets from coming from your mouth and nose, even when you're speaking. And they have done studies to show that water droplets, just with speaking, can go 6 feet away from your mouth. So interestingly, the cloth mask may not protect you from inhaling water droplets that are floating in the air from other people coming by if they're floating in the air, but they'll keep yours from coming out of your mouth. So your mask is protecting everyone else. Everyone else's mask is protecting you. And that's another way we're all in this together. Everybody needs to be wearing the mask to protect each other. The mask then also doesn't substitute then for staying 6 feet apart. Those two things together work in concert to protect everybody.
Thank you. I appreciate that answer. I'm sure many of you appreciate that as well. Let's talk a little bit about, let's circle back to kind of reopening. You know, Marian, we just got a question from Herb in Thorndale. What is the plan for Chester County moving forward?
So we have been putting some things in place, some exciting things. I mean, we're looking forward now, and we're trying to figure out how we can get safely back to business, keeping everyone healthy. So we just announced a COVID-19 business task force, which will focus on reopening, repairing, and restoring our economy in Chester County. And it's made up of every sector of business, small and large, chambers, nonprofits, trying to be as inclusive as possible because everybody has different needs, and we're going to try to help everybody through this. The next thing we did, which I think will help a lot of people, is we just approved yesterday to extend the deadline for payment of county property tax to July 31st, 2020. Again, we have decided to extend essential services only for county government to the close of business on May 15th. And I think we're going to look to put a plan together for after that. But right now, we're still going to remain on essential services. We're going to start opening parks, county parks. We have a few that we're going to open on May 6th, and we have the rest on May 12th. Now, hopefully, people will respect social distancing and we can keep them open. But we want to keep you safe, so it's important that you do follow the rules, or else we have to shut them, and we don't want to do that. We just voted on a resolution yesterday to implement Chester County Main Street Preservation Grant, which will be grants for small businesses that have an annual income of $500,000 or less, and the grant will be up to $25,000. And that is a grant, it's not a loan. And finally, we're going to continue to work to make sure that we're providing services to our communities in need, such as our homeless communities, those struggling with food insecurity, residents struggling with mental health issues. You know, it's a sad time for all of us, and we can't forget those that are in need and struggling. So we're working on that and trying to slowly figure out what we're going to do next to put this county back together, put the pieces back together, as they say.
Marian, for a lot of the information that you just gave us, I know people are watching live and this is recorded, but is there a place that our community residents can go to find up-to-date information about what's happening at a county level like you just discussed?
Yes, we have a great website from the health department to human services, everything. It's chesco.org, www.chesco.org, and you can find anything you need there. We have great information for businesses, for communities, for people that need help, even with unemployment insurance. So we have a very good wealth of information there.
That's great. Jean, I'm going to bring it from county down to borough of Phoenixville. I know a lot of people are so excited when it becomes First Friday and we have all those wonderful downtown events. Can you address a little bit about, what are the plans for the downtown events, and will they be postponed, canceled? Do you know what's going to be happening?
Sure. Unfortunately, we did cancel First Friday for tomorrow. We've canceled the food truck festival for Saturday. And regrettably, to my knowledge, probably the first time, maybe the mayor can respond to that, but we actually canceled we collectively agreed to cancel the Dogwood Festival and the Dogwood Parade. And then as you know, we have about 65 events in the season from May through October. We're taking them all on a case-by-case basis, but as I watch the news every night, I just saw that XPN just canceled their Exponential Festival 31 July to August 2nd. That's sort of the way forward. I think that the large gatherings, and I can't speak for some of the other entities yet, we're certainly looking at 4th of July fireworks, whether this is something we're going to do. We're taking it on a case-by-case basis. We're reaching out to all of those that have approved events, and we're posting them on our website as they begin to get canceled, which unfortunately I think is just the way it's going to be. It's just, you can't gather in those masses at this point in time. There's just not enough known information, and it would be, in my opinion, it would be irresponsible to hold those kinds of events.
Yeah, I think the news is not unexpected for many of us, and obviously it saddens us. But I think one of the things that, a lot of us have learned tonight from listening to the doctors and listening to Marian and everyone else is that we are still in the middle of this. So let me just pose some questions to my physicians who are on the line. How are we doing locally? What are you seeing? We don't see it sitting at home. So can you provide a little bit of light, even if it's scary light, to let us know how we're doing right now? Dr. Actor, would you like to start?
So in Chester County, we've had 111 deaths in Chester County due to COVID-related illnesses. We are still seeing an increase in the number of deaths. We have not plateaued, as they say, or come down in the number of deaths. So we still need to be very careful about gathering in groups and letting down our guard.
Dr. Gangoli, I know, thank you. Dr. Gangoli, I know you're on the front lines as well. Do you echo Dr. Actor's sentiments? Do you have anything to add to that?
Yeah, where we are right now, I would say, is in a better place than we were 2 weeks ago. 2 weeks ago, I basically did not see, almost anything that was not COVID or COVID related. I saw ICUs that were full. We had multiple people on ventilators. Fortunately, we never got to the point that we had to make, some, life or death decisions as to whom to sort of, who gets a ventilator, who doesn't. From a community perspective, what I really see, escalating, and of course, it's still very, very widespread, is infections amongst the elderly, particularly in our nursing home population. So we have a number of nursing homes in and around Phoenixville Hospital, and they've almost all been universally hit, no matter how restrictive their visitor policies were. Because the problem is that you will still have healthcare workers and physicians, nurses, healthcare aides who sort of one gets infected and they're sort of trying to mitigate that. But that being said, I think, and I really must, give a real shout out to all our healthcare providers. I mean, from our ER physicians to our pulmonary and critical care doctors, my infectious disease team of nurse practitioners and, my colleague, Dr. Katz, as well as, all our nurses and, right down to our janitors, like you said, we in Phoenixville in particular have, done a really excellent job. We've got good sort of preparedness. I would say our PPE is, optimal right now in the sense I would, it's never enough, as they say. We've learned how to sort of make do with what we have and follow some, very strict CDC guidelines. But I think sort of to get back to the other point of where we are headed, I think we're sort of starting to see the curve flattening. We haven't really, so we've definitely mitigated where things are. Now the challenge going forward will be, can we continue to sort of essentially manage to have, ongoing cases, which will inevitably develop, while having enough surge capacity that the hospitals don't get overwhelmed. I think we're doing a better job of it. I personally can say that we're, truly got a lot better in taking care of these patients, as you know and have read. It's been a unique challenge, this virus, in terms of how many ways it presents and what it really does to lung function, as well as, all the other ways and complications. But that being said, I'm a lot more optimistic than I was, 3 weeks ago.
I like to hear optimism. I think we all like to hear optimism. Let me just move over to Peter. Peter, I know in Phoenixville, we are doing a in this together, Phoenixville.com. I know that members of our community have put that together. Can you talk about, just tell us a little bit more about it and how it started and what it's there for?
Absolutely. Thanks so much, Brooke. In this together, PXV, it's a website that a number of our nonprofits, like I was saying a little bit before for the Phoenixville preparedness, we as a community were very fortunate to have an incredible health system here, incredible nonprofits who were really prepared and ahead of the game. And so almost as soon as the crisis hit, we were actually able to put out through actually the Phoenixville JCs Foundation, one of the organizations. And as Jean said, the JCs actually historically have been running the Dogwood Festival since 1943. And so in a very different way are still helping to serve the community by putting out this in this together, pxv.com. It's a one-stop website where you can go and you can get information. It links to everything from a national level, from a state level. It links to a lot of the things that Marian has talked about today, specifically around COVID-19, but it is also a place where individuals can go if they need help. So if you have any food insecurities, if you are underinsured or uninsured, there are resources for a variety of topics on there for our residents. The most important thing I can tell people is that Phoenixville has an amazing community of people who are here to help, who have resources to help, and many of those resources are listed on that website. So I would definitely direct people there so they can see it. And there's also some incredible ways that people can help out. And so, we've been very fortunate. A lot of the stuff we've been able to get from our Office of Emergency Management, they've been also helping to coordinate donations of PPE that the community has come forward with. And so that's not only gone to the hospital, but to a number of our first responders and even to our senior facilities and things like that here in the community.
That's an incredible thing to have pulled together so quickly. And I'm thankful for the JCs for helping and for our community for adding into that. Let me just take a couple questions that are coming in live here. I'm going to give this one to Marian. Marian, Neil in Oak says, what if I am scared to go back to work? What should I do?
So you're going to have to talk to your employer, but I think that the employers are nervous too. They don't want anyone getting sick. And so I think that you're going to find that they're going to have plans in place and they're going to be prepared and they're going to take the time and work with the employees. They know this is hard. It's hard on them too. They're learning a whole new way of doing business, and you're going to learn that as well. So I would encourage you to talk to your employer, have a real conversation. They should be doing that anyway. I believe that people have really good hearts and employers too, and they care about you. So just express your fears, because everybody's going to share the same ones.
Thank you for that. I'm going to stay with you since we have a specific question asked for you from Nikki Warnick. Marian, I was excited to see today's news alert about the information of the Chester County COVID-19 Business Task Force. Can you tell us a little more about the mission of the task force? And also, according to news alerts, the task force does not have representation from an important local industry, fitness studios. There are hundreds of businesses in Chester County: yoga, karate, spin, CrossFit. Would you consider adding a representative for that important industry? So that's a two-part question. First, can you tell us a little bit more about the mission of the task force?
Sure. And let me just go to the second part of that first, because we are expanding that all the time. There are so many different types of businesses, and we want to make sure that everybody's represented. So I will definitely put that on the list as well. So thank you for that. But the task force, the mission of the task force is to work together to find out how we can help businesses. For example, restaurants are going to need a new way of doing business. They're going to have to socially distance within their restaurants. They may need dividers. They're going to have special needs. So the group from restaurants that are meeting are going to bring that information to the county. And from there, we're going to take that and we're going to see how we can help restaurants in general with their needs. We're going to try to come up with a plan, even if it's sourcing material, basic material that people may need. Now with 3D printers, you can practically print everything, as Gene will probably tell you. He likes all those gadgets. But I saw that they were printing with 3D printers separations for restaurants and even airlines. So there are all kinds of ways of looking at it. We want to look at the big picture as a whole and see how we can help source, how we can help try to figure out what your needs will be. And so by coming together in these groups and then sharing that information up, we're going to be able to help every industry, hopefully, in Chester County. And there are a lot of different ones, including agriculture.
Thank you for answering that question. There were some questions from Jamie Cogney about face masks and how we were doing locally, and I think we've answered those, but I did just want to touch and say, Jamie, we have heard the question. They have been answered. If you have more, continue to post below. Let me ask a question to Jean KRACK from Julio in Montclair. Are the homeless shelters still open locally?
I think the one shelter that we have is functioning, but the honest answer is I actually haven't looked back on that. So I'll have to actually get back to you or to the group with that answer as to what is actually open and what isn't out. Unless the mayor has that specifically, because he actually talks to them on a daily basis.
Peter, can you help us with that question?
Yep, absolutely. Thanks so much. Thanks, Jean. And yeah, we do. One of the things that I work very closely with, like Jean said, are the nonprofits and their response to COVID-19. I will tell you, we have a number of homeless shelters here, fortunately, in the Phoenixville area. And what we did actually before, as we saw the crisis coming, a number of the organizations in conjunction with Chester County actually worked to ensure every person in Phoenixville who wanted to have housing had housing. And so we were able to take that population of individuals who may have lived in other types of accommodations or on the streets. We were able to get all of those who wanted and were willing to go into housing of some form. We did hear yesterday from one of our larger homeless shelters, Good Samaritan Services, that they have actually designated a very specific space in their housing. So they had actually a separate space where they could actually isolate individuals who, if they had gotten sick. But now that they're starting to look again at housing people and putting people into short-term and longer-term housing, they're actually using that space to almost quarantine people for a 14-day period before they have more of the communal or general living condition. And so they're following all of the same strict guidelines that you would probably see at any kind of group living facility. But we are starting to see our shelters come back online in the sense that they're opening. So they've been online and they've been serving the clients that were there, quarantined with them, but we are starting to see them opening up in very kind of different ways.
Thank you for answering that question. Let me send one over to Dr. Broker. Dr. Broker, this is from David at Valley Forge University in Phoenixville, and he asks, what should I do if I'm sick with something other than coronavirus? Should I go to the ER?
A lot of people are asking, is it safe to go to the hospital, the ER, urgent cares, labs to get blood drawn? All of these facilities take all of the precautions necessary to keep you safe. If it's an emergency room, they're going to keep the people who they believe may have COVID virus separate from the people who they think don't. And they're going to take all the universal precautions as if you might have it anyway. So they're going to have masks, social distancing, keeping everything clean. And so it's perfectly safe, I believe, to go ahead if you're sick and go see a physician or go to an urgent care or go to see somebody if you need to.
Perfect. That is definitely important information to have. Let me just ask the question to the doctors, and if you want to just raise your hand and I'll let you answer it. But this is from Rebecca Hernandez. She says, how accurate is the new antigen antibody test? And how do we prevent people from thinking that they are completely safe if they take the test, that if the test tells them that they do have the antibodies? Which doctor would like to answer?
I'll answer that one.
Here's a story. Okay, Dr. Broker, you can go ahead.
Sorry, we've actually been offering a lot of this testing to our patients because it is commercially available through the big labs today. And because I think it's helpful to develop data and it helps the epidemiologists to develop maps of who's infected where, that's going to help us get back to work. So we've been doing quite a lot of testing for antibody testing for our patients. They're quite accurate. Depending on the test. Some of them are, some of them aren't, but the big labs are doing testing that is 98% accurate. And so I think it's a valuable test for people to get. It's important to know what these tests can tell you. These tests can tell you with a certain amount of accuracy if you've had the virus more than 10 days ago to develop the long-term antibodies. They can't tell you what the antibodies mean yet. And that's part of what the epidemiologists have to figure out. So they'll be able to tell us once they see a large amount of testing, they tell us over the next 2 months as to whether or not the antibodies mean that you're immune. So the important part to know is that just having antibodies may not make you immune yet. And so if you have positive antibodies, even if you know you've had the disease before, we don't know yet if that prevents you from getting it again. So you should continue to behave as if you're susceptible to the disease until we have enough data and the epidemiologists have studied this, and then hopefully they'll get it done in 2 months to be able to tell us if those antibodies mean that you're immune. So we have a little time to figure that out. But I do encourage everybody to get testing. It's worthwhile to call your physicians. If you can't call your physicians, you can call us. And we're trying to get as many people tested as we can.
So for that information, to obviously everybody knows who their physician is, but to contact anybody at Phoenixville Hospital or your offices, is there a website we can go to or a place that we can find that information?
Sure, it's simple on our website. It's just the name of our practice, ENTandAllergy Specialists with an S.com.
Thank you. I appreciate that. Dr. GANGOLI, did you want to add something into the antibody test question?
Well, I mean, I think, Mike, as Brian said, the tests are fairly accurate. And when I say accurate, it means, what is the reliability that if I have a positive test, I truly have the infection, and or is it a false positive or a false negative? And that, again, factors into the actual prevalence within the community itself. For the most part, I do encourage those who can get tested to get tested because it will actually give us some kind of a snapshot into the disease penetration in our community at large. The drawbacks are number one, if you have a false positive test, which means you test positive for antibodies, but you didn't really have the infection. And that means that you could potentially expose yourself to harm. So that's why, as Dr. Broker said, please continue to use masks and hand washing as well as social distancing. The second thing is antibody testing will actually become very important even when we start to look at the response to vaccines, because that's the one thing that we're eventually looking at down the road. And so antibody testing will be very important at that point. And the last point I want to make is that the accuracy of the various tests matters, because the concern I have is also as we get into fall and we have other coronaviruses, you can have cross-reactivity with some of the tests. So you can have, there are different kinds of coronaviruses, NL63 and a couple of others. And so you can have, false positives because some of the reagents can react against those. So that's, my point.
Thank you. Let me just switch gears. I am a parent of a 4 and 6-year-old who are at home. So let me ask a question from an anonymous person, and I think Marian might be able to best answer this, is how can schools safely reopen, and what should schools put in place to help with hygiene and the process for when schools do reopen?
So I know that the schools are working together. I did have a conversation with a school superintendent, and they are trying to figure out their plans now, and they're working on them. The county doesn't oversee the education of our students. That's a separate entity and not in our purview. But we do work together to try to help each other as much as possible. And I do know they're working on a plan.
Dr. Actor, would you like to add something into that?
I did see today that the CDC came out with some new guidelines for reopening school recommendations for opening schools today that did include keeping desks 6 feet apart and cleaning guidelines for schools for reopening.
Okay, and obviously that'll be next year, since all of the parents are home with their lovely children with all this quality time that we're having right now. I'm kidding, I love my kids, but it's a lot of quality time. Let me ask a question to Dr. Broker. How many ventilators are available at Phoenixville Hospital, and how many COVID-19 patients are there at the hospital and Paoli? If you can answer the questions about the patients without breaking a client or not attorney-client privilege, but physician privilege, then please do so. But Dr. Broker, can you answer that question about our status of ventilators in the hospital and patients in the hospital?
I will tell you that I go into the hospital for some urgent procedures on airways. And so I spend sometimes in the ICU, but I don't spend as much time, quite as much as Dr. GANGOLI. And I think Dr. GANGOLI might know a little bit better about the numbers. Amit, can you tell us about that?
Well, I can tell you, at least Tower Health, which, has Phoenixville and Pottstown hospitals, actually has a fairly helpful tracker on their website. We run, I believe, somewhere in the range of about 10% of the state, total state cases. As of today, I think Phoenixville had probably somewhere in the range of 15 to 17 patients. We have enough ventilators as of now, and we have the capacity to expand. As of now, I'd say there are probably about 9 to 10 patients on ventilators. Most of them, with COVID or COVID suspected infections. So I don't know if that helps, but that's sort of definitely less than it was probably 10 days ago or 2 weeks ago.
All right, that's good information. We talk a lot about tonight. We want to bring local information. So thank you for answering that question. Let me ask a question. Do we know, and maybe my government edge of this conversation tonight can ask, is travel to other states restricted right now? Peter, do you know the answer to that question?
I would say, probably the long short answer of that is we would need to specifically look at the orders from each of those states' governors. What I would tell you is that if it's not something that's essential, if you're not an essential employee in another state, there's no reason that you should be going. I hate to be the bearer of bad news, but there's no reason right now that you should be going to another state unless it is that you're an essential. Generally, the rule of thumb is that you have to be an essential employee, or you are literally going there to care for someone who cannot care for themselves. So outside of that, I would say this is not the time to be traveling to anywhere else outside of your home.
I see my physicians raising their hand. Let me go to Dr. GANGOLI first. Dr. GANGOLI.
Yeah, thank you, Brooke. What I was going to say was that, at our hospitals, we actually have a policy that if, a physician or any healthcare worker has actually traveled out of state, we would actually quarantine them. They cannot work for 14 days and then need to be cleared by employee health before they can return back to work. We don't want to expose colleagues and especially our patients. So I don't know, it's just a hospital or a policy that's, probably from the employer, but I'm not aware of the governmental, guidelines.
I imagine that's likely because, locally our government, from the borough side and the county side and then the state side, we can only know what we're doing around each other. And Marian spoke about the communication with the other counties and with the governor to understand that information. But I guess once we go out of our state's territories, it's much tougher to kind of coordinate the response to that. So that makes sense. Dr. Achter, I know you had something else that you wanted to say.
It may not affect people locally, but I do know for sure that the state of Florida has forbidden any travelers specifically from New York. And they do have troopers at the border stopping people and ask where you're traveling from.
Yeah, I do know different states are absolutely handling it differently. Marian, let me ask you a question. I know we spoke a little bit, the physicians spoke a little bit about our protected communities, our seniors. Is there a plan at county level on how we're handling protection of those who most need it in this fight?
I'm not quite sure what you mean, because that's a wide, broad category. I don't know.
No, I know we talk about, our senior living facilities.
Oh, the long-term care facilities.
The long-term care facilities,
Yeah.
Those who are the most critical because they have been said to be the most capable of receiving coronavirus and potentially having the worst side effects of it. So is there a plan at the county level for that?
So yes, so our health department, our director of health department is working with all of those long-term care facilities and institutions and coming up with plans and helping them with their testing. There's a lot more testing available for them now, and so they're able to do more testing. And so we're working with them every day. Jean talks to all of them every day to help them through whatever they're going through. There's a problem because a lot of staff has had COVID and they're not working. And so the shortage of healthcare workers in those homes is causing enormous stress on the home itself. So we're all trying to work their way through it, but it's a difficult time for them.
Absolutely. I'm looking at my time here. We're at 8:20. I want to thank you and value your time, but I do want to give the opportunity for basically one last thing. So first, thank you for all of the community questions and the answers from our panelists. I'd like to ask each of you to give me your one last important thing that you want our viewers to take away. Dr. Broker, I started with you. I'll start again. What's your one last thing?
I want to say to everybody to redouble your efforts now for social distancing. It's currently the only thing, and good hygiene. It's currently the only thing that we're doing to control this disease right now. And I know everybody's anxious to get back to work. So I think everybody has to be actively involved in deciding what the next steps are. And we have to be in contact with our local officials, and we have to help them decide how to best do the testing and the contact tracing so that we can take the next steps and to get back to work. Thanks.
Thank you. Dr. GANGOLI, what's your one last thing?
Well, the one thing I want to say, just being a clinician, seeing and treating patients, until maybe remdesivir, which we hope will, have more expanded access down the road comes around, we really are finding that we have very, very few options to treat our patients. So the one, plea, if you will, I have for anybody who's watching this is, if you know any relatives, friends, anybody who's had the infection, has recovered from this, please get tested or have somebody, I urge volunteers to go and donate convalescent plasma. It's the one thing that we're trying to, get in our blood banks so we have one quiver in our, one arrow in our quiver to treat our patients with, because that's of great, great need right now. Obviously, the hand washing frequently and often, social distancing and masking, keep doing that. But for me, as a clinician, personally, if you can, donate convalescent plasma, get the word out. Thank you.
Thank you. Dr. Achter, your one last thing, please.
As has been said, stay home, stay safe, take care of yourself and those around you. Self-care, whether it's a daily exercise program, meditation, yoga, prayer, it's essential to your good health and your mental well-being. Remember that if you can't be of help to others, until you've helped yourself. Thank you.
Thank you for that gentle reminder. We do need to hear that. Kate, your one last thing, please.
I would echo exactly what Dr. Actor just said. It's been an extremely stressful few weeks to months, and we will get through this together, but don't forget to take care of yourself and stay in contact with your family and friends, because isolation is difficult and we're not used to it, and we need each other to get through.
Thank you. I'll turn it over to Jean. Jean, what is your one last thing for the residents of Phoenixville and beyond?
I think Phoenixville is a team. It's a team of professionals. It's a team of leadership. It's a team of volunteers. It's a team of residents all doing the right thing. And if we continue as a team, we're going to come out ahead of a lot of all of this. And I hope this is a good team.
And I know an integral part of our team here in Phoenixville is the Mayor Peter. Peter, can you give me your one last thing, please?
Thanks, Brooke. I would say, it's funny, Gene brought it up for a second, and I keep thinking about it over and over again. He brought it up a little earlier about this is the first year since 1943 that we've had to cancel Dogwood, what has generally become known as one of Phoenixville's, kind of landmark festivals. But it's really interesting to me because it's made me really stop and think about what Dogwood meant. And in 1943, when Dogwood started, it was never about rides. It was never about funnel cake. It was never about a big parade. It was really about a group of people coming together during World War II to support each other and to celebrate the community that we have. And I really want people to remember that that's what Phoenixville is doing. Dogwood is not a one time of a year kind of thing. It's not a festival. It's an experience, and it's inside each of us here within our community to celebrate what we have here. Luckily, we have amazing technology. Like Kate said, we can be in contact with our relatives. We can avoid isolation through these virtual meetings and things like that. But it's so important to remember that it's a community. It's all of us working together. It's your elected officials. It's you. It's your neighbors. It's our doctors, our nurses. It's the people delivering our mail and delivering our food who are making everything work and making everything move forward. And the only way we're going to get out of this and move forward is by doing it together. The other thing I really want to make sure to mention is, we've talked a lot about this. This is a conversation I'm sure that occupies a lot of your phone calls, probably your Zoom meetings all start with it, your Facebook Lives, your FaceTimes. But just remember that our smallest little ears are listening to this. So all of our children here in Phoenixville are listening to this, and make sure that we're asking them if they have any questions. Make sure that those children know that they're there, they're safe, and it's not their job to worry about it. So we as the adults will worry about that. But just remember, those little ears are always listening, and they are very intuitive. I meet with a number of students throughout the week over Zoom with their classes, and it's amazing the types of questions that they ask. They ask about antibody testing. They ask about, reopening our economy. So they ask some very specific questions. So they're listening to what we're saying. But I think we need to make sure that we're answering all of their questions, and at the same time reminding them that it's not their job as a child to worry about it, but that we're going to be here to help support them. And that takes me to my last point, which is, as a community, we have a number of resources here in Phoenixville to support any individual in this community or in this region who needs help. So please visit inthistogetherpxv.com. If you or a neighbor needs help, we are here to help you, and we will find you the help that you need. So make sure that you use those resources, and we're a community. Don't be afraid to use those resources, because we're here together and we're fighting this together.
Thank you, Peter, and for the reminder about little ears, although I know that they are always listening. So it is important to speak to our children. And I'm going to finish our one last thing with Madam President, the chairwoman of Chester County's Board of Commissioners. MARIAN, what is your one last thing?
Well, I love what Peter was talking about with the children, but I'm going to do a little for adults. So I want you to vote by mail, because I don't want you going and standing in lines at the polls. So please order your ballot online. I want you to fill out your census, because it's important. That helps us with Health and Human Services. And we can see more than ever right now how important those dollars coming in to counties and municipalities are, because we have a rainy day fund. Now I really know what that rainy day fund is for, but it's very important for those things that we do. Call a friend, call an old friend that you haven't seen in a long time, make a new friend, wear your mask. And don't forget to smile under your mask. It'll make you feel better. That's all I got.
I would like to thank all of our notable guests for joining us tonight and all of the community members for their questions and comments. We know your time is valuable, and I hope that we've been able to address some of the most important issues facing our community as we work together to overcome this pandemic. As you can see, our community has incredible leaders at the forefront of this crisis, and undoubtedly we will come out of this stronger in the end. At this point, I'll let my panelists leave. I'll ask my viewers to stay on for one more moment. I want to tell you about something incredible, but thank you, panelists, for being here. Now,
thank you.
Thank you. Goodbye. They're all waving. They're all waving. Okay. To celebrate our frontline workers and demonstrate solidarity and collective resolve on Sunday, May 3rd, we want to invite everyone to join together with communities throughout Pennsylvania for Bells Across PA at 7:00 p.m. All community members are encouraged to ring bells, bang posts and pots and pans, allow your kids to make all those noises that you've been telling them not to. And we're going to do that for 3 solid minutes to show the support of our frontline essential workers. So thank you very much. I'm Brooke GINTY, and I want to thank you for your time and thank you for joining me tonight for the first edition of our new VOXIPOP Community Town Hall show. Check VOXIPOP and Facebook details for our next show. And please stay healthy, stay safe, stay home to help spread help slow the spread of coronavirus. Thank you for tuning in and have a wonderful evening.